Hi, everyone. I know you have been waiting for this video once and for all. I have one of my most amazing, and I highly respect Dr. Cathleen, and I have brought her on here to talk about the hormone warfare we all go through as women from our mid 40s and beyond. So Dr. Cathleen is here. She is in South Tampa. However, she is able to provide telemedicine all over the US. She is a chiropractic physician. She's a certified acupuncturist. She is all around amazing. And I have to tell you, she has really fixed my long-term hormone issues since my last bodybuilding competition, which was over 4 years ago. And so I started seeing Dr. Cathleen probably about 6 or 8 months ago. Dr. Cathleen, thank you so much for joining me. I'm so excited to have you here.
Thank you so much for having me on. I'm so excited, especially when we start talking about health and wellness and fitness, because it all ties in together. And I've been in practice for 20 years, and I really love what I do. And it's so important for us to kind of like tie all of this together for you, our audience, to understand how your body works. I feel like the more we can teach you how to kind of like create like this check and balance system, the more likely you're going to reach your goals.
Absolutely. So I had shared with you many months ago when I walked into your door that I knew that I was suffering hormonally. And at that time I was 48. Now I'm 49 and a half. And I knew metabolically I was also suffering. And I know a lot of my clients and a lot of our viewers also have these same concerns. So what I wanted to ask you first was, any woman who's in her mid 40s, I call it being in hormonal warfare. And that to me simply means that our hormones are wildly changing, even though we may not be feeling like we're approaching menopause. Can you talk more about this and tell us how you feel our bodies are changing in our mid 40s?
Yes, well, as our body chronologically ages, a lot of times women they make excuses. Oh, okay, maybe I'm just being a mother, maybe I'm just a wife, I'm a business owner, I'm busy, maybe that's why I'm not feeling up to par, maybe that's why I'm not having sex, that's why I'm not losing weight, that's why I don't have the energy. But it all boils down to your hormones. You see, hormones are released in our body, and they're like little messengers that tell our organs what to do. And the primary organ is our brain. So sometimes the lack of motivation can be a hormonal imbalance. Or if the scale gets stuck and your weight gets stuck, it can be a thyroid issue that we need to correct just to allow your body to ramp up and to digest the food that you're eating.
So you put it very well, from the brain to the gut to the liver to the thyroid to the adrenal glands to something we haven't talked about, which gets really sciencey, the mitochondria. But all of that is like these spaghetti noodles that are connected together. And so it's not one thing, but it's really someone like you who's able to treat the whole picture. And I remember when I walked into your office and we had a very long, great consult talk. And then you handed me my paperwork to go have the labs done. And I had the labs done in like 10 vials of blood later. But this is what I love about someone who, like who really looks at the big picture. You're not just focusing on my thyroid or our viewers' thyroid, you're focusing on the big picture. And so I'm fascinated by how the big picture really does affect our weight loss in our 40s and beyond. Can you talk about that more?
Yes. So our we're approaching what we call personalized medicine. What your blood allows me to know is that what is your body doing from the inside. We might look perfect on the outside, but we have to take a look and see what's going on the inside. In our 40s, it's really critical for us to make sure that our hormones are what we call at optimum range. When it is not at optimum range, of course, symptoms like fatigue, tiredness, dry skin, dry hair, dry nails, brittle nails, all those are signs and symptoms of hormonal imbalance. or sleep issues or poor concentration. So what happens is that if we don't correct it now, and then we get into our 50s and our 60s, that will lead to early senility, dementia, Alzheimer's, and all age-related diseases. And as a woman, we're not just dealing with one hormone, we're dealing with testosterone, thyroid, progesterone, and estrogen. Those hormones have to be in balance in order for our body to function more naturally and normally.
Yeah. So after I had my first labs done, which is familiar, I talk a lot about this with our clients, our full-time clients, but I remember my estrogen being way over here and my testosterone being way down there. And it was fascinating. After, a couple weeks, you and I repeated my labs after about 3 months. And it was incredible after I saw you, and you, again, personalized medicine, changed a couple things here, we did a couple things there, and suddenly I was in balance. And so what I also find fascinating, because as we've talked about, my lane is the weight loss lane, is women in their 40s, 50s, 60s often deal with such a wild estrogen dominance that it causes what I call like the estrogen belly, like this one area of weight that is just like this big belly pooch. And so when I see women, because we require progress pictures like that, I'm often like, wow, you should probably have your labs done because you're probably estrogen dominant. So talk about how the estrogen leads to weight gain.
Well, it might start with our younger demographics. It starts with the birth control pills. They have like a zit on their face, and then they go to the GYN. It's like, oh, it's hormonal. So here at 16 years old, they're placed on a hormonal, replacement therapy, in my opinion, estrogen pills or whatever it is, birth control pills. So what that does in long term is that it depletes your nutrient absorption, like your B complexes. So all of you out there, if your kids or you are on birth control pills, please take a B complex. That's a takeaway pearl for you, because it's gonna deplete your B12, and B12 your body does not make it. You can only get it through food. So that's really important. And so when our body starts to make these hormones, and as we pop out babies or we get married, we open our practices or our business, we get under a lot of stress. So the estrogen starts to rise. But it's not just the belly fat we're talking about. We're talking about illnesses, tumors, cancers, and all the bad stuff that's going to happen. So what we want to do is that we want to decrease the bad estrogen by balancing our hormones, by really eating the right kind of foods and feeding your body with the right kind of nutrients. But sometimes you have to look at it as a multifactorial. You have to do it simultaneously. I wish we only need one thing to do, but sometimes we need it all.
Right. So the other thing that I love about you is, again, as I said at the beginning, you really approach the big picture, and you are able to say, let's not use this supplement. So of course, you and I both agree that food is our foundation, right? But then after that, because if we are eating crap, as I tell our clients, and a lot of people who just follow me on Facebook or Instagram, if you're eating crap, even if you put good supplements in your body, like it's like useless. You're wasting money. So again, we all believe that food's the foundation. And then I love your approach of, Martha, this is what you need, or this client, this is what you need. You don't need this, but you do need this. And you are very, very, very specific with your treatment plan from a doctor standpoint. And that really complements the us being specific with our food plans. So again, you don't have a one size fits all approach. And I love, love, love that. So for all the people watching us, whether they are clients of mine, clients of yours, or not, I think it's really important for everyone to realize that finding a doctor like you is not easy. A lot of women often will go to their primary care or their OBGYN. And not that I'm at all saying those two lanes of practice are not important, but finding someone who really focuses just on these hormone issues that complement weight loss I think is very, very, very difficult to find. I mean, do you agree?
Oh, absolutely. Some of our patients, they've been to like 5 different specialists. Some of them been through, a lot of doctors until they find us, because they go to their doctors and their doctor just run the basic blood work and they're like, oh, your labs are fine. And you're like, oh, okay. And then you get back into your car and you're like, but how come I'm so tired? How come I feel like crap? How come I want to kill everybody?
Right.
And so we're like, no, that's not normal. It's your
So,
body telling you something. So I always tell my patients, you're the smartest doctor in the room because you live in your body. My job is to find out what it is and to tweak you, because
yeah,
your body makes all the chemistry it needs. My job is just find out what that missing piece is, that little link, and just kind of like connect the dots and just wake your body up and allow it to work and function optimally.
yep. And I love this one line. This has never happened with my doctors, but a lot of my clients will say, Martha, I went to my OBGYN and he or she said, I asked for hormone testing and he or she said, well, are you still getting your period? Yes. Well, then you're fine. Like, no, like, wait a minute. There's so much more
Uh-huh.
that someone like you, Dr. Kathleen, can really, really, really enlighten us and assist us with, so we do lose the weight that we want, or we do sleep better, or we don't have that brain fog, or, to be quite frank, we want to have sex.
Yes,
All
and be
those things.
vibrant and full of energy. I mean, you and I we just kind of like click because of our energy. We love it.
Yeah. All right. So I want everyone to know how they can get in touch with you. And guys, I will also post this with a link above, but keep in mind that Dr. Kathleen does do telemedicine. That is so important for you to realize. Her website is drkathleen.com, and I will put all of that above in the post. Dr. Kathleen, thank you so much. You are an amazing wealth of knowledge, and I just love it because it absolutely complements everything that we do with BFit Systems. Thank you so much.
And thank you so much for having me on too.
Yeah.
I love it.